Thank you, everyone. This is such a glorious day. We've had so much happening even before the event. It is so exciting. And I just wanted to say good morning and welcome everyone here to the Dyer Care Center ribbon cutting ceremony. So, woo! This has been a journey and a long-awaited event for us to have here. My name is Margaret Fowler, and I'm the Executive Director of Totally Linking Care in Maryland, aka TLC, is for short. And for today, I'll be your MC, and I'm very honored and pleased to be able to do that. For those of you who may not be familiar with TLC, we're a nonprofit organization that is a coalition of 6 hospitals, and thank you for my board, most of my board members being here. But it is, they've just amazingly been supporting this whole project, so thank you very much. We also believe that everyone deserves access to quality health care. And I'd like to say now a little bit about the Dyer Care Center. Approximately 4 years ago, we were fortunate to be able to take advantage of a landmark opportunity to re-envision how and where people who are experiencing behavioral health services can get care. The Regional Partnership Behavioral Health Catalyst Grant from the Health Services Cost Review Commission started us on this journey, and they are here today, and I truly, truly appreciate your support in getting us where we are today. Thank you. I am so proud of not only what we have accomplished with building the Dyer Care Center and an expansion of the mobile crisis teams, but also we brought a sense of collaboration and innovation to the work that we've done here. We have been committed to building a foundation for the Prince George's County emergency crisis continuum based on the Crisis Now Best model practices to assure that we have quality care here in Prince George's County. Someone to call, 988. Someone to come to you, our mobile response team, and somewhere to go right here at the Dyer Care Center. With a no wrong door approach and getting care they need, and today we have reached that milestone. So give yourself a round of applause. TLC has worked with many purposeful and committed community partners in reimagining what that journey for people could and now will look like. I would like to give a special acknowledgement to Dr. Ariola, Dr. Levy, his staff, and also to RI, our partners in building this beautiful facility, and for going the extra miles, daytime, nighttime, and yes, Saturday too. It is with gratitude and pleasure that I would like to now introduce our distinguished and honored speakers to tell you a little bit about this whole project from their perspective so you can see the magnitude of what this is going to do. And I'd like to now turn the mic over to Mr. Dave Covington, the President and CEO of Recovery Innovations.
Thank you so much, Margaret. And what a great day. Terrific to see this facility open. None of you are old enough to remember the year I was born. But that year, in 1966, if you had a car accident or a heart attack or other medical emergency, you faced a gauntlet. In fact, you were better off being on the front lines of Vietnam versus being on a city street in Washington, D.C. in terms of getting fast, quality medical emergency care. A paper came out that laid out a plan for 911 for ambulances that could come rapidly to you and emergency departments you could actually get into. It took 30 years to build it out, but we all rely on that every day We trust that that's part of a society that takes care of its own. In 2020, we had the same situation for people with a mental health, substance use, or suicidal crisis. You are largely on your own. You faced the gauntlet of a hospital emergency department where you could stay for hours or days. And maybe you got care, maybe you just got detained. And for law enforcement, they were put in this impossible predicament where they could find themselves stuck. And sometimes they took people to jail who didn't need it. In 2020, SAMHSA put out a set of guidelines. It didn't take 30 years in Prince George's County because 15 minutes later, Dr. Belina Shaw was working on a grant. Margaret Fowler, Lori Werrell, Carlos Mackel, all of you, so many in this room who helped put this vision together. From RI standpoint, it's time for a radical reinvention of crisis care, just like we did for medical emergency care. And it involves two key things for us. We've got to serve everyone the way the hospital emergency departments had to be converted to doors that were open to all. And that's the idea of this law enforcement drop-off here, that we're not delegating people to our public safety systems, but we have a dedicated mental health, substance use, suicidal, behavioral health response for those with those emergencies. That's the majority of people who are in a crisis. And the other thing is to treat them with care that feels like care to them, with dignity, with respect, with care. And that comes from a large part from the engagement of people with lived experience. Recovery Innovations, over half of our employees nationwide are people who are certified peer supports. We couldn't be more thrilled to be here, to be your partners, to see this program move forward. Thank you so much, and we look forward to the next steps together.
Thank you, David. And now I'd like to invite Ms. Angela Alsobrooks.
Well, good morning, everyone. Oh my goodness, that's a little subdued for how beautiful this day is. Are you all feeling great? Yeah. All right, I hope so. But this is such an exciting day, and I am so delighted to be here with all of you, and I suspect that all of you all are just as excited as I am. You know, as we look out, you're going to hear many speakers talk today, but we recognize as a community that the most important thing that we do is to invest in the people of our county. And we have said it many, many times before, we make so many investments in economic development, and I said from the very beginning that human development was going to be the most important investment that we have made. Now, it hasn't been easy to do, but I am so delighted to be here yet again today for a ribbon-cutting ceremony for a very important facility that will lead the way on mental health care. And when I say lead the way on mental health care, I hope that you all will feel the drumbeat that will soon come, and that is because Prince George's County is leading on so many levels. The grant funding that Dr. Belina Shaw, thank her so much for her leadership, applied for, this grant is the first one of its kind in the state. Prince George's County is the first county in the state to have been able to use this grant funding and to have moved forward in this facility. I want to thank my partners on the county council, two of whom are here today, at-large council member, the People's Champion, Calvin Hawkins. Thank you so much, sir, for being here and for all of your work. Councilmember Sidney Harrison, thank you so much as well for his leadership. Vice Chair of our council, who's doing a yeoman's job. I want to thank also in her absence, Councilmember Jolene Ivey, who's chair of the council, and thank them for their partnership. Now, there's someone else I want to thank who's here today, because this also did not happen by accident. It happened because we also took the time to hear from our community. The Office of Community Relations, led by the super bad Unisha Davis, spent a whole year she spent out and about conducting listening sessions. And the listening session is also why this center came about. Dr. Sanmi Ariola is also one of our super bed. He's our Deputy Chief Administrative Officer over Health and Human Services. He has done a yeoman's job. Thank you so much to you, Dr. Ariola. And I'd also like to thank Dr. Matthew Levy for his leadership. He is so incredible. Thank you so much. He came about during a really difficult time. I want to thank him and all of the hardworking staff that we have at our health department. Thank you so much for your leadership and for making sure that we are leading again in Prince George's County. And they have helped to make this new Crisis Stabilization Center a reality here in Prince George's County. I'd also like to thank the Health Services Cost Review Commission as well as Totally Linking Care Maryland, who provided the grant funding that made this possible, as well as RI International and the Maryland Department of Health Behavioral Health Administration for the tremendous work that they have done. Providing behavioral health crisis care is a part of an overarching strategy to improve health care access for Prince Georgians. Since the beginning of my administration, we have worked tirelessly to improve health care for all of our residents, and we have done this in a number of ways. Opened new hospitals, new medical offices, new behavioral health facilities, and facilities for women's health access across the county. Now, you should know that although we have made tremendous investments, we are not where we are going to be. We actually conducted a health needs assessment in our county last year that told us, for example, that we needed 1,050 new primary care physicians just to bring us on the level of the rest of Maryland. And so Prince George's County has suffered for a long time from lack of investment, and so this investment is really huge for our county, and I'm so proud that we are getting this done. This is all a part of our commitment to healthy communities, and it was clear that Prince Georgians needed greater access to behavioral and mental health resources. In fact, at the beginning of my administration, Prince George's County was a behavioral health desert. Our most recent health needs assessment also showed that behavioral health is the top need for our county and for our residents. If you all can believe it, I learned during my time as a prosecutor that more than 70% of the people that we arrest on any given day and take to our local departments of correction were intoxicated when they arrived. And over a third of all of the people that we arrest on any given day and take to the local departments of correction were on psychotropic medications when they arrive. So we are largely arresting and recycling people who are suffering with mental health and addictions care and putting them in places where they could not be healed until now. So this is so important that this facility will give us the opportunity to address that need. And far too long we know that our mental health infrastructure has not met the needs of our residents. Countless communities across America do not have adequate facilities for people in crisis, and we know that too many people experiencing a mental health crisis are met with delays, denial of services, and even imprisonment. And so all of our residents deserve, we know, to have access to quality health care, care that is befitting of their dignity, that meets their basic needs, and care that helps ensure that we as a community are providing opportunities for a brighter future. So that's why we invested $20 million in the Luminous Health Behavioral Health Facility to begin creating much needed behavioral health options for our residents. And today, we're taking another huge, important step forward to provide mental health care. The Dyer Center is for anyone experiencing a crisis. This center will provide access to mental health services for all, accepting walk-ins, police drop-offs, and ambulance drop-offs. The center works much like an emergency room for people experiencing a mental health crisis. A team of specialized psychiatric professionals will diagnose, support, and treat people in distress. Put another way, the Dyer Center is a state-of-the-art crisis stabilization facility that meets national guidelines for crisis care, a place where people who feel lost can find compassion, guidance, and a path to follow, a reminder that in the midst of darkness, light persists. And so I am so grateful that we are adding this important Crisis Stabilization Center to our community. From now on, the Dyer Care Center will be here, providing a safe, compassionate place for Prince Georgians and Marylanders during their greatest time of need. So I want to say thank you so much to everyone who made this possible today, for all of the various partners. What a wonderful, wonderful day this is. This audience is subdued. I hope by the time all of these speakers speak that there will be a little bit more joy in this audience. Oh, I want to also thank our sheriff who is here as well. Thank you so much, Sheriff Carr. I'm sorry for not recognizing our sheriff, and thank him also for his leadership. So thank you all so much. What a happy day. And next, I'd like to introduce Laura Harris-Scott, who is our Secretary of Health from the state of Maryland, and ask her to come up, please, and give remarks. Thank you so much for being here, Secretary.
So good morning, everyone. I'm really excited to be here for all or some of the reasons that you've heard already. This is certainly an historic event, not only for Prince George's County, but for the state of Maryland. And it's just representative of the significant investment that we're trying to make in behavioral health, and we, the system writ large, not just the health department, but the hospitals, the county, everyone, to really meet the needs of not only Prince George's County residents, but all residents. So really, really excited to be here, and thank you to Total Lincoln Care, TLC, and RI for including us in this ribbon-cutting event. We have been working under the Moore-Miller administration for the last year and a half to address long stigmatized behavioral health conditions and seek out solutions to strengthen our behavioral health continuum of care. What we saw was the care was very fragmented, so we're now trying to build a continuum of care so people can coordinate through and not just crash into the ER when they're in acute crisis. And so having the Dyer Center as part of that continuum of care is really, really important, not only so that people have access to high-quality, culturally informed crisis services when they need it most, but it also is that connection back to the community services that will stabilize them and prevent that horrible cycle that we're seeing today. As was already mentioned by Ms. Fowler, we've been working with the county and statewide, so regardless of where you live, your age, your race, your ethnicity, your health insurance status, you have someone to contact, and that's now our statewide 988 line, someone to respond, and right now that's our mobile community health crisis teams, but more importantly, somewhere safe to get help, stabilize, and get connected to ongoing care, and that's where the Dyer Care Center comes in to service. We know many people don't access those services, and so this has the potential to not only impact, as was already mentioned by Ms. Alsobrooks, that cycle of getting arrested in and out of jail, which just perpetuates that trauma and that mental health, exacerbates mental health needs, but also has the potential to impact homelessness and, quite frankly, even death. The Maryland Department of Health recently awarded $13.5 million in funding to improve the accessibility and quality of that continuum of care, which includes crisis services across the state. And this is in addition to the investments we're making this year as well. In addition, the crisis regs that were published in May of this year now includes, or what we hope is adequate funding for the crisis services through Medicaid, which is more leading to sustainability. So as many of you know, the grants come and go. When the grants come and go, the programs go. And so now we'll have a sustainable source of funding moving forward. The center will improve, yes. And as was already mentioned, this Dyer Care Center is a testament to the power of innovative partnerships between hospitals, community organizations, the county, and the state to improve care for the community. I know it's focused in Prince George's County, but we're seeing this not only as a regional asset, but ultimately as a statewide asset. It will improve care and outcomes for Marylanders who are experiencing a behavioral health crisis. It offers personalized crisis care, provides patients with a more therapeutic setting than traditional emergency departments, and connects them to ongoing services and supports. It will also, like I said, alleviate strain on law enforcement and emergency department providers. I think many of you know we have the longest ED wait times in the country, and we're actively working on that, but this is one way that will help with that, and reduce wait times for persons seeking behavioral health treatment of care. So I want to thank everyone involved making the Dyer Care Center a reality, County Executive Alsobrooks. I also want to thank the Health Services Cost Review Commission and for their funding and support, and a heartfelt thank goes to the committed staff and leadership of TLC, RI International, certainly the county executive leadership. Congratulations on this accomplishment and your dedication to building a behavioral health system of care in Maryland that serves everyone. So thank you. See, I didn't follow my leader to say who I should introduce next. So next I want to introduce Dr. Joshua Sharfstein, Chairman of the Health Services Cost Review Commission.
Thank you so much, Secretary Herrera Scott. It is just incredible what you are doing and the Moore-Miller administration is doing all across the state for health. So I am the chair of the Health Services Cost Review Commission. What in the world is the Health Services Cost Review Commission, and why are we here to support the opening of the Dyer Center? So that is a fair question, and the name of the Health Services Cost Review Commission does not give it away. So we are a commission that oversees hospital payment in Maryland. And hospital payment in Maryland is different than hospital payment in 49 states in the District of Columbia. It's completely different. In other states, the hospitals are basically paid like hotels. You need someone in the bed for the payment to be made. You need a head in the bed. And if you don't have that, there's no money. You know, if a hotel says, we've got a great idea, we're going to keep people from coming to the hotel, that's not a winning business strategy. But Maryland is different. Maryland, we have a special arrangement with the federal government where we have flexibility over the funds for healthcare. We can use some for hospitals, and we can use some to prevent people from going to hospitals. That's what makes Maryland different. That's what made it possible for the Health Services Cost Review Commission to say, we have too many people going to the hospital for behavioral health conditions who don't need to, who could, if they got care in a place like this, never need to be in, you know, a terrible environment for people who are really suffering, the emergency department. And that led the commission to say, well, what ideas are out there to help people to prevent? Only Maryland has that ability to do it, and only Maryland is doing it at this kind of scale. Now, that led to the regional partnership grant that you heard about that created $23 million over 5 years to make this possible. So that policy, that underlying uniqueness to Maryland made it possible, but it only made it possible. What made it happen was everything else. What made it happen was leadership from the county, certainly led by the county executive. Ms. Alsobrooks, I have a special message for you. My mom says hi. Okay. If I didn't say that, I was in big trouble, okay? But also Dr. Areola, Dr. Levy, the county council. So many people need to provide leadership for something like this to happen. It also needs a strategic vision, and you heard about Belina Shaw, who provided that vision. She is a psychiatrist. She understood the county needs, the hospital needs, the patient's needs, and she put it all together in an incredibly compelling proposal. I am so excited that Dr. Shaw is here to see this. While she was writing that, she happened to be a student at the Johns Hopkins Bloomberg School of Public Health, where I work. She was the recipient of a Bloomberg American Health Initiative Fellowship, and used some of those skills in putting this together. She came up to me beforehand and said, I was working really, really hard on this proposal, Josh. Thank you for letting me take some of the classes pass-fail. So, but the truth is she is an all-star student at the school. She is an all-star county employee and now with the federal government, really making an incredible impact. It also needs management. It really needs to be run well, to be put together, and TLC and RI are just remarkable organizations that have made this possible. It needs partnerships with community organizations, law enforcement, and others to be successful. So the Health Services Cost Review Commission, so proud of being able to make it possible, but it was you all that made it happen. Thank you so much for inviting me today.
Thank you, Dr. Sharfstein. The next person that I would really like to ask to come up today is very special and dear to my heart and has been so supportive throughout the whole thing, Ms. Lori Werrell, our chairman of the board.
So first of all, I would like to thank Dr. Sharfstein for explaining what the HSCRC is so I didn't have to. You did it much better than I was going to try. So good morning, everybody. My name is Lori Werrell, and my day job is that I am the Assistant Vice President of Care Transformation for MedStar Health for MedStar Southern Maryland Hospital Center. And I am currently the chairperson of TLC-MD, Totally Linking Care. On behalf of the TLC Board of Directors, I welcome you to this ribbon cutting for this amazing facility, the Dyer Care Center. It is a pleasure and a privilege to be here and to be able to speak to what the opening of the Dyer Care Center will bring to the healthcare continuum in Prince George's County. 4 years ago, Dr. Shaw and I spent our summer vacation writing this grant. But it was only possible because 3 of our member hospitals, Adventist Healthcare Fort Washington, MedStar Southern Maryland, and University of Maryland Capital Region, agreed to work together, competitors collaborating, to apply for funding to build a better continuum of care for behavioral health services in the county. This was only possible because several hospitals had joined together years ago to form TLC-MD expressly to be able to apply for HSCRC grants and other collaborative funding opportunities to improve the health of our region. For something of this magnitude, we also needed the partnership of Prince George's County and a shared vision of what is a first-of-its-kind Crisis Stabilization Center. Based on the Crisis Now model, and what that could be. Because of the visionary leaders at those 3 hospitals, in the County Executive's office, in the Health Department, we are standing here today on the brink of opening the Dyer Care Center. Maryland's hospital emergency rooms are overcrowded and not necessarily the best place for someone experiencing a behavioral health crisis. If they do not require acute medical care, they're chaotic, they're loud, they're noisy. This state-of-the-art center will allow citizens to be triaged and stabilized in a calming environment. Wait till you see it. It's gorgeous. And only transported to an area hospital when needed. By providing this level of no wrong door access, most will be able to be stabilized and safely returned to their community with a care plan and a connection to treatment resources. By having this first-of-its-kind facility in our county, we will reduce ER utilization and better serve those in crisis. This will also allow for more efficient use of our EMS and law enforcement resources to allow them to safely and efficiently bring people to a place they know they're going to get taken care of and get back out where we need them. A win for all involved. So TLC would like to thank the HSCRC, acronyms, man, we're throwing them around today, aren't we? For developing this funding opportunity to transform the crisis continuum. Because it started with the HSCRC. I mean, it's a government agency thought outside of its box and made this possible for us to innovate and collaborate. So with this funding, we are providing access, increasing mobile crisis teams, providing this amazing facility, and ensuring follow-up by our many dedicated behavioral health partners in the community. I would personally like to thank all of the many people in county government. And let me tell you, we learned more about water and fire suppression systems and cable than we ever really needed to know. And if it weren't for the experts in county government to get us through that, this wouldn't be happening today. RI International, you stuck with us. We appreciate you. And the amazing TLC team. I cannot say enough about Margaret Fowler. She and I have known each other for a very long time. And when we needed a new executive director, she appeared like a dream. Carlos Mackel, where are you, Carlos? Carlos is the man. He brought the expertise that we needed to get this project across the line. And if you haven't noticed, I'm getting a little emotional because this has been a really tough road, but we did it. So thank you for coming and enjoy the rest of your program. And I'm going to try to follow directions, although I'm not good at it, and ask Dr. Levy to come up and speak next.
Lori, thank you. Good morning, everyone. Good morning. It's wonderful to be here today on Monday morning. It's not just any Monday morning. It is a special Monday morning because today is a significant milestone for public health in Prince George's County as we celebrate the opening of the first Crisis Stabilization Center in the state of Maryland. I'm going to say that the first. The Crisis Stabilization Center is a transformative addition to our community and surrounding areas, offering immediate crisis services for mental health and substance use challenges that people face. The center is open 24 hours a day, 7 days a week, to ensure that no one is ever alone in crisis, and they can reach services regardless of the time or day. By providing immediate assistance, stabilization, and safety for individuals in crisis, the center addresses a critical gap in our mental health and substance use care continuum. This aligns with our new vision that all Prince Georgians are their healthiest at every age and every stage. And we are dedicated to eliminating the stigma surrounding mental health and substance use treatment, as this can be a major barrier for people seeking health care. It is important to share this knowledge that mental health and substance use disorders are treatable. I want to express my gratitude to the partnership between TLC, RI, my health department staff, and our community partners for making this a reality. This took all hands on deck. Facilities, communication, IT, our LBHA, our behavioral health division, budgeting, everybody was on board. And this collaboration between all of us enhances our county's ability, our overall public health response, and our ability to support our community. The Dyer Center Behavioral Health Crisis Stabilization Center, that's a bit of a mouthful, offers community-based, no wrong door, quick access to care, reducing the risk of harm, and offering help to manage symptoms. Our goal was and is to prevent unnecessary emergency department visits and inpatient admissions, and to offer great care coordination, linking people between the crisis and our community partners who provide behavioral health and mental health services. These initiatives are vital in promoting mental health awareness and resilience across Prince George's County. The Crisis Stabilization Center is part of the SAMHSA Crisis Now Care Continuum. And we couldn't do this without our key partners in the Maryland Department of Health, the HSCRC, the Behavioral Health Administration, Totally Linking Care, working together inside of Prince George's County to serve our community. We heard before that an individual now can experience that, who experiences a behavioral health crisis, has that continuum. Someone to call at 988. And if that doesn't work, then someone to respond in our mobile response teams. And if that doesn't work, a place to go, which is right behind me. The Crisis Stabilization Center stands as a beacon of hope and a cornerstone of our public health infrastructure, and provides essential care and support when it is needed most. I want to thank you for your continued support and dedication to improving the health and well-being of our community. Thank you. And now I'm going to follow directions, and I'm going to introduce the wonderful Dr. Belina Shaw, who is now the Senior Medical Advisor of the Center for Mental Health Services and Substance Abuse and Mental Health Administration, or SAMHSA, and she really was instrumental in making this possible. So, Belina.
the county executive said that people were subdued. I came bright colors, excited, my heels on, a party. I haven't worn heels in a long time. I said, I am coming for a party. This is so, so, so exciting. So I come on, I do formally come from the U.S. Department of Health and Human Services. That's the Substance Abuse and Mental Health Services Administration, also known as SAMHSA. I'm the senior medical advisor there, and I also am the liaison to the 988 and Behavioral Health Crisis Coordinating Office. This is why we use acronyms, because there's too many words in all these things. And I am excited to be here because as a federal agency, this is what we want the states and the communities to do. You guys are a model. And actually, one of my activities that I do at SAMHSA is I help counties to create this. I actually run policy academies and bring together their stakeholders and help them do this very thing. So it's good that our front door is already swept before we go, try to support the rest of the nation. As a county resident, I'm just so proud of the work that's been done. And also, I do come, as folks say, personally. So I was the medical director for the Behavioral Health Division of the Prince George's County Health Department prior to coming to SAMHSA. And just to be frank, this project was the one thing that really kept me struggling and saying, do I want to take that federal job? Because this was my heart. This was my baby, and it really started. I'm going to tell you guys a little story. All right. So we were in the midst of the pandemic. I'm doing COVID care kits with Caitlin and sourcing international thermometers to send to people and things. This is the midst of COVID. And I get a call from the executive director of TLC, and he starts asking some questions around crisis. And I'm like, that's interesting. Why are you asking? And he said, well, there's this grant. We're thinking of applying. And I said, oh, that's nice. When's it due? In 3 weeks. I said, well, that's great. If you need anything, you need any support, you need some ideas, just let us know. But I'm not writing your grant. And so then, about 2 days later, I get a call from the health officer. And Dr. Carter says, TLC has this grant opportunity, and I need you to help them write that grant. And so I had the pungent taste of foot in my mouth. And the foot was in my mouth for 2 reasons. Number one, I was helping to write a grant, and it was a team effort. But number two, the other reason my foot was in my mouth was it was no longer their grant. It became our grant as a community, as a county, with this public-private partnership. And that's really the most important piece. I mean, Lori has been there the whole time, and I honestly, the only reason I had time for it was because I was supposed to be on vacation. And then, so this was really, truly, literally summer vacation, because, you couldn't go anywhere, though, so we were at home. So we said we might as well keep working. All right, so I'm here with my bells and whistles with these two elements of that story. That I'm not writing your grant was chapter 1. And the process of this I'm not writing your grant moment, I went to TLC and I said, here's the concept. This is what the HSCRC is asking for. This is what SAMHSA is saying. And to really do this right, and I really do think we need this is how we do it. And they're like, well, how much is it going to cost? I'm like, $23 million. And actually we asked for more in the very beginning. And they're like, what? I'm like, $23 million. And so, I think that it should not be lost that this is a major risk. This is a very significant risk because the HSCRC asked for a model for which there was no regulatory or fiscal infrastructure to sustain. And the state is just getting to this now, 4 years later. And this is not unique. Every state, every community is going through these processes. So this is not a dig on Maryland or the county or the processes. I see it that from the federal level, from that vantage point, that everyone's doing this together now in the same way and trying to figure this out. And that the only reason this worked was that it was predicated on trust, right? That TLC trusted us with the vision that we gave them, and said that we have this. Is it going to go off a cliff? And we said then TLC said, we trust the health department, we trust the state, we trust MDH, we trust the HSCRC that they're going to be there with us to see us through if this is what the community needs. You're gonna make me cry too, Lori. And then also, it's predicated on trust, and it's predicated just once again on partnership. And the second piece is build the plane as you fly it of this little story. And we were trailblazing. This was the only grant of the HSCRC grants that created the highest fidelity model to the SAMHSA guidelines. And so other crisis stabilization like centers will be opening in the state, but this one is the highest fidelity one. And we knew that that was going to pose a challenge. And as we were doing this, we had eventually procured our RI, and I say we because we were helping to write, as the health department, it was technically their money, but we were writing the notice of funding, it was helping to review the proposals. This was truly a joint effort. And so RI came in, and RI is like, we've done this in a couple of states, and sometimes it works, sometimes it may not always work, and they were a little rocky sometimes. But as that man over there, Carlos, that said, I got you, we're gonna see this through. I'm like, okay, Carlos, if you can see it through. And so, we really are disruptors to care as usual that we need in this nation right now because our mental health is suffering. And this type of service is necessary because although we are in a predominantly minority county, in the states that RI has done this before, RI is the leader in creating these types of services and programs. In the states that RI has done this before, you guys showed us data that showed that Black and brown people utilize it at a higher rate than the majority population. And so we knew that this was the actual model that's going to keep people out of the jails and emergency rooms, that this specific model was the one that would do it, and that you can't water down the model if you want to get people out of the emergency rooms. And so my lessons from this Build Your Plane as you fly it chapter were that it was the persistence and patience. I've been at SAMHSA now for almost 2 years, right? And we wrote this grant in the midst of COVID, before vaccines were out. Do you remember those times, right? And just also the reason that they had not really gotten to it is because they were doing COVID work. They were keeping us alive, like the hospitals were. And so they were all busy. We were all doing it together. And as far as health equity is concerned, there were more COVID cases in this county than there were at some point states in the nation, right? And so they were doing this, and that's why they were like, but we don't want to let it go. We don't want to let this opportunity go. And I'm glad that Dr. Carter tugged on me to do that. So I just want to say thank you to everyone. Thank you to the HSCRC, to CMS that's not here, for the Centers for Medicaid and Medicare Services, that does create this unique model. I was actually at a meeting last Friday with the medical directors, the regional medical directors of the chief medical officers of CMS, and with our regional directors, and we were thinking about how do we decrease ED boarding, and I said, CMS and this type of program has done it. I said, this is your model if you want to show other communities how to do this in the nation. And actually it'll probably be on the agenda for one of our topics in the future. I want to thank the Prince George's County government. This is in this building because of a special fiscal relationship with TLC, right? That they gave the shell for this. And real estate in Prince George's County is not cheap, right? So to be able to get this building for $1 is really how we were able to use the funds to be able to build this out in this way. And so I just want to thank Prince George's County for doing that. And then also just the collaborative support of all of the staff. As I was leaving, Dr. Somerville, she's like, what are you doing? and she took it on. And really just TLC and Margaret, we traded back pain, literally, as soon as we did this, because it's really a labor of love. But I'm just so excited that this here is a trailblazing moment. And I can no longer, as a former resident in Baltimore City, current resident in Prince George's County, no longer hear Maryland's the leader, except. I always hated hearing Maryland's a leader except, and it'd always be Baltimore City and Prince George's County. And this here is saying that actually this is the leader and everyone else is following. And I really feel proud also that Montgomery County is asking us for questions about how to do this themselves too. So thank you guys.
Thank you, Dr. Shaw. That's amazing. Thank you. The next person that I would like to ask up is a very important person as well. And where is Miss J.B. Moore? She is the Executive Director for NAMI.
Oh, wow. Good morning, everyone. I agree with Dr. Shaw. This is an exciting day. My spirit is actually jumping for joy. You may not be able to see it, but I am happy. And I represent a lot of individuals and families. So I'll start formally again. Good morning, esteemed dignitaries and distinguished guests. I am J.B. Moore, Executive Director for NAMI Prince George's County, Maryland, a local affiliate of the National Alliance on Mental Illness, providing peer support services across the county. As a family member and legal guardian of a loved one living with a serious mental illness, I am honored to be here today to represent individuals and families across Prince George's County impacted by mental illness. On behalf of such individuals and families, thank you to each and every one of you here today that has played a role in the establishment of the Dyer Care Center. This center is truly a blessing to the communities all across Prince George's County. Thank you for recognizing that individuals experiencing a mental health crisis may not always receive the proper response. Thank you for embracing the vision that our loved ones experiencing a mental health and/or substance use crisis deserves an appropriate behavioral health response. And thank you for ensuring that there will be peer specialists to provide support, education, and encouragement to our loved ones. Because you dared to care, our loved ones will have greater access to effective, traumatic-informed care. Because you dared to care, behavioral health crisis services will be delivered to our loved ones by behavioral health professionals in specialized settings rather than in emergency rooms and jails. Because you dared to care, when our loved ones find themselves in crisis, families can trust that the crisis has a greater chance of being resolved as quickly as possible, with a focus on supporting our loved ones' return to the community for additional support. NAMI is grateful to have participated in community stakeholder meetings over the past 4 years during the development of this long-awaited Crisis Stabilization Center, and applaud lead organizers for implementing a whole community planning approach. Thank you, County Executive Angela Alsobrooks, for your leadership and support in establishing the Dyer Care Center, and for helping to ensure that our loved ones in crisis will not only receive the care that they need, but receive it with the dignity and respect that they deserve. And before closing, I'd like to give a shout out to the Prince George's County Council and the Health Department and the local Behavioral Health Authority for their continuous support of the very important work that NAMI does. Thank you. And now, I have the distinguished honor of introducing Vice Chair of the Prince George's County Council, Sydney J. Harrison.
Good morning. So I'm standing here with Chair Emeritus Calvin Hawkins, my colleague. As you all heard, he's the people's champ right here in Prince George's County. I'm bringing greetings and salutations from the County Council. The Chairwoman Ivy, she could not be with us this morning. She's on county business, but I wanted to have the opportunity to bring remarks before you from the County Council. Let me just first off start by saying thank you to everyone that has been involved in making sure that this day happens right here in Prince George's County. This is a trailblazing effort, as you all know. It takes partnerships, it takes community leaders, it takes our healthcare professionals to make sure that we're able to do everything that we can do to provide the equity and access and creating the equality that we want to see right here in Prince George's County. I want to thank the county executive as well, County Executive Alsobrooks. Just for a moment, just think about this. Over the last 6 years, our county executive has partnered up with leaders all across the state of Maryland to ensure that we got funding of a total of $166 million to make sure that Prince George's County is not the stepchild of the state, but we are the leader in our healthcare landscape. So County Executive Alsobrooks, I want to thank you for your leadership over the years. I mean, millions and millions of dollars to make sure that we are able to improve our infrastructure and partnering up with our healthcare partners. It's been great leadership. Thank you. I also wanted to talk about why the importance of that is so important. If you look at our county, we're about 1 million strong in our county. We're about 88.8% persons of color in Prince George's County. If we were considered a city, we'd be the 16th largest city in the United States of America. And so when you look at equity and access, when you look at what our Prince Georgians deserve in the county, they deserve the most top-notch healthcare system in the country, where compassion and empathy and care and dignity is served to all of our residents here, right here in Prince George's County. Mr. Carr, you know, Sheriff Carr, you know, I'm putting my clerk of the court hat on, but what I did see after COVID was a 50% increase in filings for emergency psychological evaluations. And what does that mean for our healthcare partners? Where do these individuals go that need top-notch care? This center provides that opportunity where we could have cultural competency and care for our residents here in Prince George's County. That does matter. And so I just wanted to take the opportunity to say thank you to everyone involved to make sure that this day has come forward. And I also want to thank the media. The media, what you say and do, the power of your narrative to make sure that we as a community are getting the message out there that some of the challenges that we face, but where our priorities need to be and how that funding needs to happen. I appreciate the coverage that you all are covering this, because this is a groundbreaking moment right here in Prince George's County, and everyone across this nation needs to understand that we, as Prince Georgians, are leading in this healthcare landscape. Thank you.
Everything has been said for all of our partners from the private side to the public sector. Would you just stand? We don't want to end subdued. We want to stand. We want you to applaud each other for all that you do. Please stand with me and give yourselves a hand. Please, everyone, please. And while you're standing, the poet once wrote, I got, for a public servant, there's always miles to go before we sleep. For one particular individual over the last 6 years, she's been traveling those miles and she has so many to go before she before she sleep. And we want to just thank you, because this may be the only time, County Executive, we have a chance to thank you for your vision, particularly for a situation like this. We talk about the partners involved, but if you did not give the green light on this, we may not be here today. So on behalf of the County Council, we want to thank you and your team for making this possible. Thank you all.
As you can see, it doesn't take 1, 2, 3, 4 people. It takes all of us. And there are some that are even behind the scenes. But together, we are stronger. As a team, we can get it done. So I want to thank every one of you for the part you've played, and you've heard every aspect of how this Dyer Care Center was able to be here today. So give ourselves a hand. And as Dr. Belina Shaw and Lori know, it has been a labor of love. And I'm sorry, I'm listening to everybody. It is an amazing feat to have such wonderful partners to be able to get this done. And with that being said, we can now go over and cut the ribbon. So please come over and cut the ribbon, and then we'll have tours. Thank you.
No, actually that's bigger. And the other one had like the phone case. It was, it was just too much stuff that I'm trying to put into.
All right, man. So I'll see you when I see you.
See you when I see you.